Tell me who you are and what do you do?
Alright, so my name is Sumeet Vadera. I do epilepsy neurosurgery. I'm the director of epilepsy surgery at University of California in Irvine. I've been there for just over 2 years. I do a lot of epilepsy surgery. I do general neurosurgery. I do spine and brain tumors as well. I do have a passion for epilepsy surgery. I feel very strongly about raising awareness that it is a good option for people and that it works very well and it's very safe.
Okay, so tell me more about surgery, because I've been told that have gone through a surgery program myself.
Okay.
But at the end of it, I've been told I'm not a surgery candidate.
Okay.
And I haven't been given any options apart from maybe VNS is the only other thing.
Okay.
But so what I'm sort of kind of interested in is what would have happened if I went ahead with surgery. So
the way I kind of
what's the process? So I've already been through MRI and video EEG. And
did you have any a lesion on the MRI? Did you have anything that they
yes.
found? Okay.
So they found things on MRI, but on video EEG, no seizures showed up.
How long did they have the video EEG for?
For 2 weeks.
2 weeks.
So the question is what happens next is going through the surgery process.
I would recommend you have the process. You go through the process again, especially if you have a lesion on your MRI and they weren't able to capture a seizure. I would recommend going through the process and doing video EEG again. In terms of surgeries, there's two broad categories of surgery. We have diagnostic procedures where we implant electrodes onto the brain and into the brain, looking for the specific location where the seizures come from. And then we have other therapeutic type surgery where we actually will do a resection, take out a part of the brain, we'll do a stimulator implantation, we can do a laser ablation. There's several options, and maybe some of those things may not have been available when you were going through the process originally. But I think that the important thing is that in patients who have failed 2 medications, the next step that they should try and go through is to go to a level 4 epilepsy center where they could be evaluated for possibly surgery. Yeah. It's unfortunate there's a lot of patients who don't know that surgeries are available. Surgery is safe, it's effective, so I think that's really important.
But okay, question is, how safe is safe?
I quote less than 1%. In terms of major complications, I say less than a fraction of a percent of stroke, coma, paralysis, death. Those things very, very, very uncommon. Major things like bleeding and infection, probably 1 to 2%. Very safe. If you look at
does it depend where a lesion takes place?
Not necessarily, no.
So if
surgery is certain.
So if a lesion is within visual field at the back of the brain, for the optical nerve and area, what happens if brain surgery is done there? Does vision get taken away, or
well, there's a lot of factors that go into that.
Or does it depend on where the lesion is, affecting motor skills or language?
There's a lot of factors that go into it. Depends when the seizure started. Depends if your brain has had plasticity. Maybe functional parts of the brain may have moved depending on where the seizure started. There's a lot of parts of the brain that are effectively quiet, so we could do surgery and take those out and you may not have a problem. Sometimes people have a problem from the seizures, so that if we did surgery, they're no different. So if it's in your motor area, you may have some weakness. If it's in your vision area, maybe you already have some vision problems. So there's a lot of factors. Really, the important thing is that if you go to a level 4 epilepsy center where they can evaluate you and treat you and give you all the different options, those patients, we can tailor a surgery or an approach to you rather than going through, and there's no cookie cutter answer for these questions.
Okay. So, tell me about why it's really important to bring epilepsy out from the shadows. So, when we're talking about stigma, things like
I think it's, I think that it's very unfortunate that there are lots of patients who would benefit from surgery who could actually be cured from epilepsy, and who either have, don't know about surgery, or they have these wrong preconceived notions about the safety of surgery. I have patients come in and tell me that I'm going to be a zombie if I have surgery, I'm going to go blind, or maybe I'll become paralyzed. And I have a list of patients who have done very well, and I would tell you that if it was my family, I would recommend surgery. I would not hesitate at all. If I, so I think it's a really good surgery. The benefits far outweigh any risk.
So that's a really good positive thing to hear. And so lastly is what do you think about events like this for people to come to Epilepsy Awareness Day? It's a really fantastic day for to learn, but also to hear to ask questions.
Yeah, you said it best. You said it best.
What do you think?
I agree with you.
Is this your first time?
No, I did this last year.
Did it last year?
Yeah.
What do you get out from the day yourself?
I enjoy meeting people. I enjoy, possibly giving information and teaching people, and maybe I could, increase awareness. And that's really the reason I enjoy coming to things like this.
That's really great. Okay, thank you for talking to me.
Sure, very nice to meet you.
Thank you. Nice to meet you.